Does Vermont have enough resources to treat young people with serious eating disorders? Some clinicians and people struggling with disordered eating tell us no. The age group with the most severe eating disorder cases requiring hospitalization is young women. Vermont hospital admissions data from 2016 to 2019 shows the number of 15 to 24-year-old women needing inpatient treatment went from 16 up to 28. And sometimes these cases are prolonged or severe enough that the young person needs a level of residential care that the state doesn't have.
I did a lot of sports. I think that was like a really big thing for me.
Amelia Cassidy says her goal heading into her senior year of high school was to have the best cross-country season possible.
I think it had always been kind of the like skinnier is faster kind of idea.
But the stress and anxiety turned into an obsession over what she ate.
It's like addictive almost. It pulls you in and it's like, oh my gosh, I had an extra piece of toast at breakfast, like, you know, and then the panic sets in.
By the time summer ended and the season started, she had developed anorexia. It might have gone untreated longer if Karen Bates hadn't noticed her daughter wasn't eating enough.
I was like, oh my goodness, you know, she should be eating 2,000 calories a day, and I don't even know if it's 1,000. She just looks skinny, really skinny. And so I called her doctor, actually.
A doctor's visit confirmed Amelia had lost an unhealthy amount of weight. She was told she needed to gain it back.
And so I was frustrated because I was like, well, I'm doing this for my sport. It's okay. And seeing these influencers on Instagram who, you know, are skinnier than me. And I was like, what are you talking about? Like, they're literally worshipped for their bodies. Why are you upset with me for losing all this weight?
She didn't want to eat, and she had anxiety around eating.
She went to book appointments with nutritionists and therapists, and that's where Karen says they realize the gaps in eating disorder care for young people in Vermont.
I had heard that, you know, dialectic behavior therapy was probably the best approach for her as an anorexic, and there's no one that was available. And so that was frustrating because I knew what might work, and I couldn't get it for her.
Their story is one Kate Morris hears all too often.
We're playing whack-a-mole.
She's a licensed clinical social worker and intuitive eating counselor based in central Vermont, and says often practitioners will try to form teams to help a patient, but
those are piecemeal. And that is a lot of work for someone who is not at their best.
She says Vermont lacks the wraparound care, nutrition, therapy, and counseling provided by inpatient and residential eating disorder treatment centers.
That's a big hole in care.
And having that hole here forces youth struggling with serious eating disorders and their families out of state.
I think, you know, being away from a support system, being away from the comforts of even the landscape that you recognize, all of that can feel both pathologizing and just incredibly uncomfortable and scary.
If you can get into one of those out-of-state programs.
If you can get into one. People are reaching out to treatment centers more than ever. Their wait lists longer than ever.
One example of the increased demand. In a letter to Vermont Senator Bernie Sanders last spring, the executive director of the Multi-Service Eating Disorder Association in Massachusetts said the number of individuals they served went up 700% since March 2020. And over the last 2 decades, 20 to 25% of their patients have been from Vermont, including nearly 60 at the time of the letter. Morris says she sees people on wait lists getting sicker.
They get on a wait list and then they think, all right, well, I'm just going to wait to get better till then. But that might not be coming for a month or two. And the eating disorder can wreak a lot of havoc in the meantime.
What would you want to see Vermont do?
Best case scenario is we do it here.
She wants to see a residential treatment option for youth here in Vermont and thinks with COVID relief money, the state could make it happen.
We have that opportunity for people to stay here and to benefit not only from the wisdom and expertise of Vermont clinicians, but also the beauty and serenity of the Vermont landscape, which is their home.
Do you think there needs to be more options in Vermont for people who are looking for help with an eating disorder?
Definitely. I think that I was really lucky in the fact that my mom had me on all these wait lists, but there aren't enough doctors for everyone. I mean, I was on a wait list for, I think, weeks, almost a month or more.
Amelia says if her eating disorder had gotten much worse, she might have had to seek residential care out of state. But just in time, she started working with the Calm Clinic in Burlington to overcome her anorexia. Their approach worked for her.
I genuinely don't think I would have recovered to the point that I have without like that clinic. And the fact that so many people don't have resources like that, it's just sad kind of thinking that they're going to be stuck in this cycle forever.
It took time and effort, but she's now fully weight restored and a member of the varsity girls rowing team at the University of Toronto.
I don't see food as a number anymore, which is incredible.
Both she and her mom wanted to share their family's story to encourage more people to talk about eating disorders, to break the stigma around them. And they say they want a centralized resource for eating disorder patients and their families, with supports that are easy for everyone to access.
The family has to be able to go to these places as well and get the training they need.
How long are young people waiting now to get care? Good question. The state doesn't track it at all. I asked both the health department and the mental health department that question, and they told me they had no data. The Agency of Human Services did tell me that during their recently completed wait time study, there were several anecdotal patient reports of long wait times for pediatric eating disorder treatment. But again, no one collected data to get a sense of how widespread the problem is. And no one also offered up any solutions that the state might be pursuing either.
What about any clinics, Kat? Did they give you a sense of the demand for care?
I reached out to a couple in Chittenden County, and the Calm Clinic in Burlington got back to me. They say right now they have 20 pediatric patients who are being treated for eating disorders. They tell me it takes about a month for a new eating disorder patient to be seen by them, and that's even with prioritizing them because they told me those patients, quote, simply need care the most.
A report from several eating disorder treatment advocacy groups says 9%, or about 55,000 Vermonters, will have an eating disorder in their lifetime. It affects men and women, but women are twice as likely to have an eating disorder. It can begin in kids as young as 5 years old up to elderly people, but adolescents, teens, and young adults are affected most. And it comes at an economic cost, with the study estimating nearly $124 million a year in lost productivity, informal care, efficiency losses, and health system costs due to eating disorders. Eating disorders are both a mental health issue and a physical health one. So how do clinicians help manage the complex intersection of those and get patients on the road to recovery? Cat Viglienzoni visited the Calm Clinic in Burlington to find out.
Calm Clinic registered dietitian Elena Eford always has food behind her desk.
Each of these cubes are an ounce of cheese.
Not real food, rubber food.
So it's really to clarify, to figure out exactly how much they're eating.
She uses it when eating disorder patients come in to help them show her what they're eating.
Like, this is what a normal plate of food looks like. Whereas someone with an eating disorder would be like a quarter of that. And they're like, that's plenty of food. I'm like, no, 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 no.
With these models, she then shows them what a healthy plate should be.
But with food, a lot of people think they can do it on their own.
Can they do it on their own?
No. No, that's actually a big misconception with eating disorders, is that you can do it on your own. And that's why a lot of people don't get the actual care that they need, and why their eating disorders last or progress for longer than it needs to.
And coming up with their recovery strategy starts with a body baseline. One of the treatment tools that the Calm Clinic uses is something called metabolic testing. It basically tells the person what their body is doing, how many calories it's burning while it's at rest, what type of fuel is it using, and that can tell them what an eating disorder does to their body. And Elena is going to show us how it works.
And this is just going to go over your head.
It feels like being in a spaceship. Once I'm in, Elena says, just relax.
You're going to breathe for 20 minutes.
By measuring the carbon dioxide I breathe out and the oxygen I take in, the machine shows how many calories I'm burning, so a dietitian could see if I was burning more or less than I should be. And if I weren't eating enough, how much of my lean body mass, like muscles or brain or organ tissue, my body would be using to replace the fuel that's not coming in from food. In my first report on eating disorders last month, one of the Calm Clinic's former patients, Amelia Cassidy, credited her recovery in part to the clinic's use of metabolic testing because she said the numbers don't lie.
I could see the numbers clearly in front of me. And Elena took this like no BS approach where she was just like, listen, like these are the numbers. Like I'm not making something up, because I had spent this entire year almost like paranoid that people, you know, my doctors and my parents were like out to like make me fat, this fear of being overweight. And it turned into this paranoia. It was them against me.
Eford says it is common for people to doubt whether their eating disorder is serious, especially if they've been praised for losing weight. A metabolic test shows them the damage not eating enough is doing to their body.
And it really helps actually with the patient's buy-in, right? A lot of times people come in, they're like, I don't think it's that bad. We do the metabolic test and they're like, oh, maybe I do need help.
She can then use a body composition analysis that measures fat and lean mass to track their progress or regression over time. Eford says their clinic also tries to create a team for their patient, a therapist, physician, even a psychiatrist too. But there are limits to what she can do, seeing someone once or twice a week for an hour or so.
They might need a lot more than that. They might need meal support, 3 meals every single day, and none of that is available in Vermont.
Does Vermont need that?
Yes, absolutely.
What would that do for you as someone who works in the field to have that option in the state?
It would make it so that our care is actually a lot better. Right now in an outpatient setting, we're seeing people who maybe shouldn't be in an outpatient setting because there's no other options. Whereas if I had an outpatient place 30 minutes away or 15 minutes away, and I could say, hey, you need to go to inpatient here, you need to go to partial here, they wouldn't have to remain an outpatient for as long. So they're not getting the...
She says in an ideal world, Vermont would have many levels of treatment for eating disorders, from mid-level care where someone might spend part of a day at a clinic, up to residential care for those who need round-the-clock meal help. But Vermont doesn't have either of those right now. The only inpatient care is if someone is basically on death's door and is hospitalized. It happens to dozens of Vermonters each year. Health Department data shows 86 people were admitted to the hospital in 2019 for eating disorders, about the same in the 2 years before that. But once they're medically stable, they're discharged, and the cycle continues because their eating disorder itself has not been treated. But as Cat found out, lawmakers are now stepping in.
This is how I try to get people to tell me like what exactly they've been eating.
At the Calm Clinic in Burlington, registered dietitian Elena Eford has been treating eating disorders for years. How far are people driving to come to you for treatment?
I think my furthest is 2.5 hours.
What does that say to you?
That there's not enough treatment in the state of Vermont.
She says the Calm Clinic's wait lists reflect that. They try to prioritize eating disorder patients, but even then, it might take a month to see someone new.
And that's really scary if someone's got a really dire situation.
Those dire situations, she tries to help as best she can with meal planning and metabolic testing, which measures what a patient's body is doing and how their eating disorder is affecting them physically. But she says the reality is severe cases need inpatient care with meal support 3 times a day. And if patients need that, they have to pack their bags because the Green Mountain State can't help them.
They would literally have to leave the state and go seek treatment.
Have some of your patients had to do that?
Yes.
Abby Hawkins was one of them.
I was so tired that I couldn't get out of bed. And I was skipping classes.
The 22-year-old from Rutland says her eating disorder started when she was just 12 years old. But it wasn't until about a decade later, in winter 2021, that the George Mason University student and type 1 diabetic realized it was slowly killing her.
That was kind of the point I realized if I don't deal with this, this is either just going to kill me or I'm just not going to live any life that's worth living.
She was home in Vermont while school was remote. She spent a week in the hospital here. But it was in Massachusetts where she finally got the inpatient treatment that she really needed to start recovery. Even after that, she says her insurance wouldn't cover residential care.
It took a long time to come to terms with how bad the problem was, to get to the point to ask for help. And then to hit so many walls in access to treatment, it made me question if my eating disorder was actually that bad, if I actually needed to get help.
Do you think if eating disorder treatment had been more widely available and more talked about, that you might have sought it prior to being in your 20s?
if the resources had been available, I likely would have sought treatment earlier, but I just didn't know where to turn to or what there was available, and realizing that there isn't a lot in Vermont in terms of resources.
Addison County Senator Ruth Hardy wants to change that.
And it's pretty clear that our health system, broadly speaking, isn't really adequate to help people who are struggling.
Has the state taken agency over this problem?
I don't think so. I mean, I think there, to be fair, there are a lot of problems that the state is trying to solve.
She says her teenage daughters have friends whose families told her finding care, even support groups, is impossible here, especially for those who don't have the means to travel. And she knows too well that eating disorders are the second deadliest mental health disorder, second only to substance abuse.
Back when I was a kid, one of my best friends had a severe eating disorder and eventually passed away because of it.
Language she's adding this week to a Senate bill would require the health department to create a working group to find out what services Vermont has and doesn't have and report to lawmakers on how to improve them. The goal? To have a report in January 2023 so they could take action next session. Do you think this is fast enough for families who are struggling?
Unfortunately, no, I don't think so.
Back at the Comm Clinic, Eford welcomes any progress that might lead to more options for her patients. If you had a wish list for Vermont for eating disorder care, what would be on that list?
So in an ideal world, there'd be a residential place and then at least a partial program.
Why do you think the state doesn't have that yet?
To be honest, I don't know.